Hello, everyone, and welcome to another episode of School Life Ready Talks. I'm Dr. Cecelia Lynch Mitchell, pediatric occupational therapist, and I am here with my co-host, Jen.
Hello, everyone.
All
Yep,
right.
I'm Jennifer, and I'm a mom of two children, two amazing children that are on the spectrum, just living our life every day.
And every week we are here at 7:30 to talk about all things pertaining to being parents of children with disabilities, and really and truly just topics that are pertaining to being parents and raising children and doing everything that we do for children. So again, welcome everyone. Last week, we had an amazing show. Jen wasn't here because she wasn't feeling well. And I want to say thanks to Kendra, who is listening tonight. Thanks,
Thank you.
Kendra, for filling in and sharing with us her perspective of not telling her children about their disabilities. So it was good to have the different perspectives from mine and Jen's, because Jen and I, we share the same thought process that we should tell our children about their disabilities and how it affects them on a daily basis and strategies that they can use so they can have a more fulfilled life, right?
Yes.
So we did that last week. Tonight, we're going to be talking about neurodiversity. And although I'm a therapist, I must say that the term neurodiverse, I wasn't quite sure of what it meant, because when I was going to school, there was back in the early 90s. That's to age myself. Or no, that's not true. The late
The
90s.
late 90s. There you go.
Neurodiversity wasn't a very common word. So we didn't really use the terminology neurodiversity. What does neurodiversity mean to you? When you hear it, Jen, what do you think of when you hear of neurodiversity?
I think of everyone.
All right,
Um,
tell me more about that.
yeah, so that's what I think. I think about the fact that everyone's kind of on the spectrum because the spectrum is so big. We all have our quirks, if you will. And like I know that I don't like loud things, so I get overloaded, like over sensory loaded when there's a lot of sound. So that's what I think about is like there's a place for everyone.
Okay, cool. So it by your definition, you're thinking neurodiverse just means everyone, because no two people are the same, and so we are all neurodiverse. Like it's a diversity, it's a mix.
Yes.
Um, when I first heard neurodiverse and it was being used in the sense to describe a lot of the children that I work with,
Right.
I was thinking neurodiverse meant that it applied to people who didn't fall within the what we would consider typically like like normative behaviors and stuff. But what I'm beginning to realize is that you, Jen, would be more what it is. Like we're all so different. And is
Yes.
there anything as norm? You know what I mean? Like I feel like norm is it's beginning to fray like what we usually think, like okay, what we thought of as normal, say in the 90s, changed a little bit to where it's more normal in 2000s, right? And then so it looks like as a population or as a culture, our norms are more things are included in the norm,
Yeah.
right? So I think in a way, like you are on top of it with that mindset. I looked up the definition of neurodiversity, and the definition of neurodiversity based on a lot of I kind of put it together. Um, and the definition of neurodiversity is the idea that the brain is different for everyone, just as you were saying. It's different for everyone,
Yeah.
and there are things that are naturally occurring, like people are just, it just happens, right? So these are natural occurring differences, and that these differences, they're there and they're natural, and they're not things that need to be fixed, right? They just are. And with that, like there's certain conditions that fall under neurodiversity, and we'll cover some of them later in the show tonight. But they're like different conditions that makes us different in a lot of different ways, but at the end of the day, we are normal. We're normal, functioning, able-bodied people. We're just different.
Yeah. Yep, I agree. I mean, that's what comes to mind to me is we're all different, but we're all the same. So it's just we all have our little spectrum, our little pockets on, in a spectrum, on the spectrum, if you will.
Yeah, well, we all have our little differences, and it's funny because I think that having this fancy word to just describe people is kind of cool. Like it makes individuals be able, again, as we were saying in previous shows, like they can identify with something that can say, all right, I am neurodiverse. I'm not cookie cutter. I'm not, I'm different. And so is my friend. He's like neurodiverse, because no two people are the same,
Right.
right? And we all process things differently. So, absolutely, I think we're all neurodiverse. But for the sake of literature, and for the sake of, how I think as a society we have to like put people into categories,
Yeah.
I think the neurodiversity helps to, it helps by having this word that describe individuals who are outside the mainstream
Mhm.
on different things, like children or individuals who have autism, who have ADHD, who have learning disabilities, who have different visual and verbal functioning patterns that are different than what we typically see. Individuals with syndromes like Tourette's.
Right.
What else I can think of? There's this word helps to aid us as a society in providing and adapting education,
Right.
and in some places adapting public spaces that can help. And I must say, I was traveling yesterday, and I noticed in the airport there was a quiet room. I was,
Oh.
Yes, there's a quite so a lot of public spaces are now catering to our differences and
Yes.
and making inclusive spaces for individuals who are neurodivergent, or I guess I don't know what it is I would have to do because I was going to catch a flight when I saw the quiet room, and I'm suddenly like, quiet room, but I don't know what you have to do to say I want to go into the quiet room. So I
Yeah.
said, next time I go to the airport, I'm going to go find out, what who gets to go to the quiet room. Can anybody walk up and say, hey, I would like to go spend some time in the quiet room? I hope so. I hope it's wherein anybody can just go and say, they can spend some time in there. If anybody knows anything about the quiet rooms at the airports, please let me know. Tell me what that's about,
Mm-hmm.
because yesterday was my first time seeing it. I did not know that the airports had quiet rooms.
Yeah, I didn't know that either, but I know that a lot of places are making space, and I think that, I mean, it just makes me feel really appreciative to the moms and anyone and everyone who advocated to get autism and everything out there, just continuing to push it along, because this didn't happen overnight, if you will.
Yeah, absolutely. We have had
Oh,
lots of people, and predominantly parents.
yep.
Parents have been the drivers for a lot of these resources that are now available to children, right? It hasn't really been the doctors and the therapists.
Scientists.
It really has been parents that have come together and made things available for other parents. For example, that website that Alondra told us about, the autism website that had put together all these different resources, from financial resources and strategies and companies together. They put the whole list together on that website. We could find anything on that website that would can help our children with autism. So, and it wasn't just for children with autism; it was for families with children with any disabilities. But again, that was parent driven. And the organization Parent to Parent, which guys, they're parent2parent.org. They're about to lose funding for what they do. So they're looking for donations. So if anyone is listening and can, help Parent to Parent and donate, please continue to support these organizations, because there are a lot of funding cuts that are expected. I don't know when these cuts will go into place, but there are a lot of organizations that help get some funding from the government, and a lot of those organizations are losing their funding. So please help us help our children by helping us to help these organizations that are here for our kids. So yeah, so that was a little plea right there. But yeah, so we I saw this at the airport and I was ecstatic. And
I bet.
I was extremely ecstatic, extremely ecstatic. So tonight I wanted to delve a little bit more into these neurodivergent, things that are considered new for individuals who are neurodivergent, and some of the diagnoses that are considered neurodivergent, as I said before, was autism, ADHD, Tourette syndrome, learning disabilities, dyslexia, um, communication disorders, anxiety, and even obsessive compulsive disorders. Those all fall into the neurodivergent categories, and I'm pretty sure there are more out there, but those are the main ones. And tonight we're going to talk a little bit about the difference in these conditions. So the first two we'll talk about, maybe the only two we might delve deep into tonight, will be ADHD and autism. And previously, I had mentioned that most children who are on the spectrum also have a diagnosis of ADHD as well, especially in their younger years. And then in their older years, they have other diagnoses along with autism, and some of those diagnoses might be anxiety or depression. So again, it's important that we start from early, being
Right.
very involved in the lives of our children who have or are predisposed to having autism and ADHD. So we look at some of the similarities with autism and ADHD, and both affect attention, sensory regulation, and social communication. And I know a lot of times we don't notice the differences in social communication with our kids with ADHD. Because a lot of ADHD kids are very talkative. But if you delve and look more into it, you will see that there are some deficits with social communication. With your younger son, Jen, how would you describe because your younger son has ADHD, well, is diagnosed with ADHD, but is not diagnosed with autism. But what would you say about his social communication? Well, how would you describe it in terms of its similarities or differences with its similarities, I would say, with your son with autism?
They speak quickly, very high level. It's extremely loud, the way that they speak to one another. And as far as social issues, I would say that like the difference would be that one is more emotional, like he internalizes it, and the other he externalizes it, if you will.
So which one
The younger
internalizes?
one internalizes it.
So your child with autism
He he
internalizes like things that's said to him.
No, the one on the spectrum will externalize it. Like he wants you to know that he's upset and why he's
Okay.
upset. So that's a very clear difference that I see.
And the one with ADHD, he doesn't speak up about how he's feeling. I'm not quite.
Yeah, no, he internalizes it. Like he just shuts down and like
Oh,
crawls
got
into
you.
his body and then he's done for the day. He's not talking to you.
So your child with ADHD tends to more shut down and withdraw,
Right.
but your child with autism tends to just voice it and say it as he
Right.
sees it. Got you.
Right.
And that's I think that's pretty typical for children with autism to just say things
Yes.
because they're not taking the time to think about the social context and
No.
that thing. but also the kid with your son with ADHD, he tends to shut down. And there are two ways that I think with the kids with ADHD with their social communication. They are the ones as well who, like some kids with autism, will just blurt stuff out and say it because they didn't have that filter, right? But there are also some kids with ADHD who will shut down and withdraw. But the kid with autism, for the most part, they're just going to say it, and they're not going to make it pretty. They're just going to say what they are thinking. And that a lot of times, for the social communication part of it, like a lot of times when kids with autism say something, a lot of people will like kind of recoil and like, what did he just say? Because he's not meaning to be mean, but because he's not reading those social cues, or know not to say certain things, like.
Oh no, I'm going through that right now. Like I know exactly. Like he goes and like shares so much, so many conversations that I've had with people around me, and it's like, why are you sharing my conversations? So I get it.
I know. I know, and a lot of times parents they cringe at what their child might say out, but they know, don't even bother say, don't say. You know what I mean? Just if something comes out, just explain that sorry, he or she doesn't mean, they're not trying to be mean. That's just how they perceive whatever they're perceiving, and they're expressing it. It's not like they're not trying to be mean, they're not trying to be ugly, although what they say may be taken as mean or ugly by the person who they're saying it to.
Right.
Yeah, so I know. I've seen so many cases, and I've been through a lot. I've been on the receiving end of a lot of mean things being said to me.
I bet you have. I have too.
But
So I can't imagine.
yeah, and I mean, I have so many different children with autism that I work with, and I've had so many different things said to me. The last one I got was, Dr. Cece, you're an old lady.
Oh no.
I know, but it's so funny. So because I think he was trying to he was trying to categorize who's young, like the term young and old, right?
Right.
So he doesn't really know, like, whatever the concept of like, I was like, I mean, I'm older than his mom, so I am an old lady. But in the context of things, I'm thinking I'm not as old as your grandma.
You're so funny.
Oh goodness! But it was so funny that he said, and I was like, well, technically, yeah. In his world, I am an old lady. You know what I mean? Because he is just he's beginning to learn these context of who's young and who's old, so yeah, for him I am an old lady. For me, I'm not an old lady, but for him I am, and I just have to accept that. But I've had a lot of different things said to me over the years with this. But that was the most recent one that I the most recent one of an example of children with autism just saying things, just expressing themselves from their perspective. So yeah. And so differences with autism and ADHD is that autism often includes differences in the social interaction, the communication style, and the repetitive or intense interest, right? Wherein a kid with ADHD, they might just show something, attention to something, except video games, for a short period of time and then they're moving on to something else. They're not sitting there perseverating on the same thing over and over and over and over. They're not trying to stay with the same activity over and over. They're kids with ADHD, they're more impulsive and more hyperactive. But then again, remember that if the kid has autism, they might also have the diagnosis of ADHD. So a lot of times you'll see a kid who is have autism, who's also dysregulated and impulsive and hyperactive. All right. So yeah, so that's really some differences and similarities. Now, last week we spoke about should parents tell their kids about should parents tell their kids about their diagnoses and their disability. This week we're going to go back before telling, we're going to go back to should parents even seek out a diagnosis if they notice something. Jen, what do you think?
I think that it's important that you do. And so the reason why I say that is because you have to have the diagnosis to get the help. Otherwise, your child's going to be looked at like he's having behavioral problems instead of having sensory issues or, whatever he might be experiencing at that time. But I know that I personally believe that early intervention is the best thing, and it's been reviewed out there that it is the best thing to do. Besides that, I do think that I think that the child deserves to know as well.
Mm-hmm.
Because children talk a lot. I mean, they feel things, and I think that it's important to tell them too. So for that reason, yes, I do think that you should get a diagnosis if you can.
And you know what, Jen? Again, you and I agree.
Yeah, and because it doesn't change anything. Like he is who, or they are who they are. Amazing.
Absolutely. I strongly believe that yes, when the behaviors are significantly impacting their daily life, whether it be socially, emotionally, academically,
Mm-hmm.
or just overall function wise, yes, parents do seek the diagnosis. Definitely seek the diagnosis, because one, it will help you as the parent as well to have a better understanding, especially if these behaviors are to the point wherein it's affecting them at school and teachers are calling you or they're being sent home or they're being suspended. Because a lot of times, these behaviors, as Jen just said, they are mislabeled. And we know for a lot of children, they're labeled as being bad behavioral kids that needs to go to alternative schools. You know what I mean? Like they're not thinking that this is the regular school is correct for them. They're getting kicked up. Sometimes it starts so early. The kid is only like 3 and they're getting kicked out of daycare. I've known children to be put out of daycares. So it really helps for parents, and it also helps the kids when we get them the diagnosis. So yes, if you think that your child's behaviors is indicative of these neurodiverse conditions, get them the help, because a diagnosis can open the doors that you need to get services to help them. It can open the door to get them special educational services that can provide them with accommodations and adaptations at school. It helps the teachers and the caregivers to better understand what's going on with your child, instead of mislabeling your child as being a bad kid. And overall, it gives your child and you the language to understand exactly what is going on. So yes, I agree with Jen. Get your children diagnosed. Seek out those diagnoses. Is if you think that your child has any of these conditions, or if even if you're just seeing things that you don't know what to do. So Jen, where did you start your journey when you saw things that you knew you were like, no, I have to do something isn't right here? Where did you start your journey?
I started with a pediatrician, and then we went through Babies Can't Wait, so that was helpful. But I quickly went and visited the Marcus Autism Center, and then I went in and I got a proper diagnosis around here. So
Okay, so you were able to, so for your first child, did you do the same process for both children?
no, for my second child, it's much harder to get help when your child isn't labeled when your child has a label like ADHD. Um, and so he actually has ADHD and dyslexia, and getting a dyslexia diagnosis takes a very long time. So we just now got that.
Right. So it sometimes it takes a while.
A
But
very long time. And
but
don't stop fighting. Please
yeah,
don't.
sometimes it's right. So if you go and you don't get a diagnosis, but you're still your child is still suffering because he's not functioning well in school, or is having difficulty with peers, and also having difficulty at home, and you can't find a if your pediatrician won't do the diagnosis, make sure that you keep asking for referral to different people, so you will eventually get there. So what I would tell parents is start with your pediatrician. Step one, start with your pediatrician and share your concerns with your pediatrician. Now, I've had it where I've seen where the pediatricians themselves have said, oh, they'll outgrow it. I think you can give it a 3-month period, but don't wait till the next year to go look into it and wait for that pediatrician. Follow your gut. Sometimes you have to change pediatricians, and if anything, go online and find like parent support group, and they normally they'll have in there pediatricians that they have worked with, that have helped them to get their child diagnosed. Should the child, if you really feel like, yes, there's something wrong, something, my child is struggling in all these different areas, then it's okay to change pediatricians. A lot of people stick with the same pediatrician. You don't have to stick with the same pediatrician. You can get different, just like if you were to be ill and a doctor doesn't help you the way that you think you should be helped, and you go and you seek a second opinion, or you go and seek a second doctor, you can do the same thing for your child. So start with your pediatrician. Ask your pediatrician for developmental screening, and if they're not equipped to do it, have them make a referral to a developmental pediatrician, or a pediatrician that specializes in dealing with children who are not neurotypical, right? Then, as Jen mentioned before, reach out to your, in Georgia, it's called Babies Can't Wait. So that's the early intervention program. They serve children birth through 3 years. So in Georgia, it would be Babies Can't Wait. But in whatever state you're in, it might have a different name. So you can reach out to the early intervention program in your state and get resources and services through them.
Or, sorry, you can also go to the children's hospital websites, and you can find different resources there.
All right. Okay, thanks for that, Jen. Yep, check out the children's hospitals websites, and you will see what's available as resources for you as well. Then the next step would be your local school district. So normally when a child turns 3, they're eligible for instruction within the school district. And they're also, many times they're eligible to receive related services like occupational therapy and physical therapy. And they can also at times receive speech therapy as well. And some places now are having like counseling and psychological counseling. You will also get a psychological evaluation to see if your child is eligible for special education in the first place. So that will be the first step when you contact your school district. They will perform a comprehensive multidisciplinary developmental evaluation, and that will include psychological testing, motor testing, and cognitive testing. So, and what's the other word they use for where the child can, adaptive skills, for such as like dressing and feeding themselves and using the bathroom. They'll look at the whole child. They'll do a full comprehensive evaluation in the school system. And then, as your child gets older, seek out the occupational therapist, the speech therapist, or the psychologist, depending on the nature of your concern. So definitely get started if you don't sit back and wait, because early intervention is key. As Jen always reiterates, early intervention is key.
For sure.
All right. How can Jen and I help you? Jen, what can we do to help parents? What can we offer parents tonight as a form of help? If you're a parent that is concerned about your child, like, what would you say to a parent tonight that is thinking that maybe they should look into getting their child diagnosed?
Looking to get their child diagnosed, I would say collect as much data as possible. So just write down different times and occasions where you feel like something's a little off. All of the data that you collect it's all going to be helpful. So don't, I know it seems like you're just monitoring your child, but I promise it'll be helpful. I actually had to go through a couple of evaluations to end up getting my youngest son evaluated, and I kept going back and adding data. And I think that that really helped with the diagnosis.
You know, Jen, is so funny. I think you've been in the special ed world for for
Yeah.
definitely for 10 years now.
Yes. Um,
Because like a lot of parents are probably thinking, data, data, what data?
I
So
know. I use the same language. It's kind of funny. It's
Jen
hilarious.
is have been through so many therapies and services, and Jen says get data. But what she's really saying is write down what you're thinking, what you're seeing, what you're observing going on with your child. Like, so more like write down your observations so that when you do go into the pediatrician, you're not you're giving the pediatrician so much information that they can't deny what you're saying, right? So write down, make sure you write down what you're observing, write down what your concerns are, write down when these things happen. Like, when do you notice them? Do you notice them? Is there a pattern, or are they just random, right?
Yeah.
Because the more information you have written down, the easier it is for you to communicate with these individuals who you're trying to get to help you to get your child diagnosed. It's, as Jen was saying, data, they get data. But
Yeah.
really make
Can
sure
I
you
I
have it.
want to give you guys an example. So my oldest child, um, he has a couple of subjects that he's not a fan of, and with my data collecting, I made the observation, I saw the pattern, I should say, that he does better with the subjects that he's not good at if they're given to him in the morning, and then after recess, the subjects that he does like. And so we were able to move things around to fit that schedule, but that goes back to, collecting data and realizing that my kid is, he's stronger mentally in the morning versus in the afternoon. Uh, or, if vice versa. And so, but it's knowing those patterns. I think that that's very important.
Yeah, that is absolutely, absolutely important. So, really, really just having the more information you have, guys, helps. One, it helps to push the process along as well. Because, granted, when you get into the school system, when you get to that, it's going to be the school who's telling you they have to collect more data. It's not going to be you. They're not going to take your data, because getting services in the school, they'll take your data because there's some questionnaires that have to be filled out by the parents. But the school might also tell you that they have to get their data. And I'm sure, Jen, when you tried to get your second child to get diagnosed and to get services, you had to wait for the school to collect data while you were also collecting data so you could bring everything to the pediatrician for the ADHD diagnosis, because getting those diagnoses requires parents to fill out questionnaires. So you have to know how you're answering those questions, right?
Yes, and also, so the way that it works here in Georgia is that children have to go through these tiers, and so each tier is like 3 months of moving up or down the tiers, and it takes a long time, and it's something that I wasn't too happy about. So I was collecting my data because we had to go through those tiers. I want to say, do you remember? I think it was like 3 times we had to go through it. Um,
Well, they started you at tier one, where they looked for certain behaviors, and then and they give certain, Well, what Jen is talking about is the in-school process to get what it was to get your child to get special ed services, right? So
Right.
that's the process to get the special ed services. They first put the children through a tiered system, where the first tier is they have like certain objectives, and then they give you certain strategies. Now, if the child does well at that first tier, then I guess they stay in regular ed. But then if with those strategies being implemented, if the child doesn't improve, then they go to the second tier, wherein I guess they increase the strategies, um, and increase the objectives that they're working on. And then if the child still doesn't get better, then they go to the third tier and they do more strategies and more intervention. And if the child still doesn't get better, then they're like, oh, I guess he or she needs to go to special ed, and they do the process to get them to special ed. So that's for in the educational system. But I
Yeah.
was
The
thinking to get diagnosed with ADHD from the pediatrician. Um,
yeah,
there's information that you have to be able to present to the pediatrician as well. It's not, you don't bring your child in and go, oh, I want a diagnosis of ADHD. The pediatrician gave you like a form and gave you like a questionnaire that need to be completed by the school as well as by the parent, right?
yes. And then the reason why I brought up the tiers is because I actually asked for all of that data to always be sent with home with my child. That way, I also had it to give to either if it was a psychological evaluation or if it was to my pediatrician or whomever needed it. That way, I also had it and got, to show them what was happening. But again, mine was more so dyslexic. My child is dyslexic, and that's a very hard thing to diagnose. So you have to see the patterns. But I think that it is important to put out there because I can never have enough data.
All right. So if you are considering getting the diagnosis, any diagnosis for your child, as Jen said, get your data. Start writing your observations down. And guess what? If it feels important to you to write it down. It might be relevant, it might not be relevant, but that's okay. Just write down any information that you think is relevant as it pertains to your child. So that way, when you meet with the pediatrician, you can communicate clearly as to what your concerns are and what your child is doing. When you get to meet with the early intervention team, you can do the same thing. When it's time to get into the school system, you already have certain basic information ready to help fill out all those parent questionnaires that you will be given, and be prepared to do paperwork. Be very prepared for paperwork. There's a lot of things that need to be filled out typically, to get your child diagnosed and to receive the services that can help them. So don't be afraid of anything. Just take it in steps, and there's always someone to support you. Whether I know in the early intervention system, they have social workers that work with you and help you through the system. For the schools, I am not sure who does the supporting the parents part of it. It might be social workers that help to support you as well. I know the schools have social workers. I just don't know if they're as involved in the intake into special ed process as they are in the early intervention. But there will always be someone to support you. Just ask. Just ask who can support you. And I know that the educators and the administrative staff will do their best to get you the support to help you through the process. Because at the end of the day, our entire mission, and I'm speaking on behalf of healthcare providers, therapists, educators, doctors, at the end of the day, we want what's best for you and your child. So don't be afraid to ask us for any support. In the same way, Jen and I are here for you on a weekly basis. We're here to support you. There are other individuals out there, other parents out there, other service providers that are out there who are there, will be there for you, and are there to help you through this. So tonight, guys, parents, know that you are doing an incredible job, and keep doing what you are doing. And that's all for us tonight here at School Life Ready Talks. Jen, last wrap up and last word to take us out, please.
Yes, everyone, be safe out there, hug your little ones, and I will look forward to seeing you guys next week. Thank you.
All right, guys. Thank you so much for tuning in to another episode of School Life Ready Talks. Follow us at SLR Insights on YouTube, like and subscribe, and on Facebook at School Life Ready. Email address schoollifeready@gmail.com. Continue to reach out to us, and we will do everything to provide you the information that you ask us for. Have a good night, y'all, and we will see you next week. Bye,
Thank you.
guys.
Bye.